Okay, so with part 2, what you were just watching, you should have then continued on to do this activity where you sort of look at actual how the policies are actually applied. Now, I should tell you that you pay your copay or at the doctor's, and then your insurance pays the remaining part of the bill. But every so often, you might get another bill in the mail from your doctor's office because your insurance company maybe didn't pay the full amount, that they disputed it, and so you might still have further bills. Hopefully not, but that happens. So when you get to the end of the activity, I think what you should have seen was you ended up spending, and if you're off a little bit, that's okay, but $2,700. Came up with $2,710. We declined in class the getting our teeth cleaned this year. We'll get them cleaned next year, but you could have spent more. You did not hit the $3,000 out-of-pocket maximum. Now, in addition, premiums were paid. You could put either the premiums that you paid or the premiums that you and your employer together paid. So I'm going to put the ones that you paid, because you didn't really have a choice. Your employer was going to pay those premiums anyway, but they did have a choice, so that might be food for thought. So I'm just going to round it up to $7,500 was paid for in premiums. And that means your total that you spent out of your pocket was $2,710 plus $7,500 in premiums. So you spent about $10,000, $10,200 that year for your medical expenses. And then when you add up all the bills, it's roughly $10,800, give or take, and you probably have slightly different numbers. But what you should see from this is that you did save money. The medical bills added up to more than what you spent. And then what you should also see is you didn't necessarily save a lot. Health insurance and taking care of yourself still costs a lot of money. So you really want your health insurance for peace of mind, because your bills could have been much more. And if they were much more, you would have reached your out-of-pocket maximum of $3,000, and then insurance would have picked up the remaining part of the bills. The other thing I wanted you to see here was, come January 1st, down here, it's a new year. So you have to start all over. So that $2,700 that you've spent, you're real close to your $3,000 out of pocket. This next time you have a really big bill, that doesn't send you over the out-of-pocket maximum. We're starting back over. So you have your urgent care visit. There will be a copay. Those x-rays, if you're in network, are probably covered, and you might have these other things covered. So that is sort of how health insurance policies work. There's a lot more detail to it, but that was a great introduction for you to kind of understand the vocabulary and how the basics of health insurance work. So I want to go back to now looking at healthcare in the United States. Looking at healthcare, how it works, and then what the Affordable Care Act is supposed to do. So problems with healthcare before Obamacare. Some have been fixed, and others might seem to be fixed, but we really won't know for a little while. We have to sort of collect the data. We do know more Americans are insured than they were before Obamacare. So the first number one problem for health insurance in the United States is, unlike other first world industrialized democracies, we don't have health care for everyone. We don't have socialized health insurance for everyone. So we have a lot of uninsured people. And those numbers have gone down. More people have gotten health care because of the Affordable Care Act. You might not feel that, though, because Texas hasn't necessarily expanded its Medicaid. And that has left a lot of poor Texans still uninsured, that if they were in another state, they'd be insured. So why people are uninsured? They might not be working, or they might be working but not full-time. You could work 2 or 3 part-time jobs and never get health insurance through them because you're not employed full-time. You could be self-employed or employed at a place that's very small and isn't therefore required by law to provide insurance. Then you have this other problem that is hard to explain. It's that people have insurance, but as you can see, the out-of-pocket costs throughout a year can still be really expensive. So there are some folks with insurance, but they don't necessarily use the insurance because they can't afford the daily costs. So they might avoid going to the doctor to avoid costly copays or lab fees. And you could see with the breakdown, if you had a coinsurance of 70-30, those are still really hefty bills for a person. Now, when we think about the uninsured and the underinsured, they're not exactly getting a free ride. Someone pays for their medical treatment when it gets to a point that they need it. Someone who is uninsured avoids going to the doctor because they cannot afford it. But if they don't take care of themselves and something happens and they end up at the ER, the hospital there is required to take care of them. And when that person doesn't have insurance, they will get them out the door and out of the hospital as fast as possible because the hospital is going to have to recoup that money. So when someone is uninsured, they can go into a hospital and get medical care. But if they can't pay for it, that means the hospital is going to have to raise prices essentially to offset what they've lost. And guess who pays those higher prices? Those with insurance. So people being uninsured is a concern even for those who are insured. It's not just, oh, I have insurance, I'm good, I don't have to worry about them. Part of why your insurance is costing so much is because there are uninsured people. And that's just also very tricky for people in the medical profession, how to balance their budgets when they have to somehow offset those costs. Another problem is that Medicare is an entitlement cost. Remember that term entitlement? That means that it is an expenditure the federal government has promised and has to keep paying no matter what. So Obamacare was supposed to eliminate waste and abuse to make Medicare more efficient. And also, if Obamacare as a whole could lower healthcare costs, that would also bring down Medicare. Another problem that insurance companies before Obamacare, so this one has, I could say, been fixed, is that your insurance companies could deny people coverage if they had pre-existing conditions. And so that was a problem because some people who wanted insurance, who were working at a place that would provide insurance, didn't qualify. And it also led to a lot of people maybe not leaving a job because they were too scared about a gap in coverage. If you discover while you're insured that you have some sort of costly disease, the insurance company can't drop you then. But if you leave jobs, you leave one insurance and then you go to sign up with another insurance, those new insurance companies might deny you coverage based on a pre-existing condition. So insurance companies no longer should be denying people with pre-existing conditions. Also, coverage for older kids, which in 2008, when Obama was really pushing the Affordable Care Act, there are older kids, people 18 to 24, who need insurance and they're not able to find insurance through employment because they might not even be able to find employment. So insurance companies now have to allow parents to keep their kids on the policy up until age 26. Now, remember, it's not free. Parents still have to pay the higher premiums to keep their kids on, but the idea is that they, if they pay, can continue to keep their kids on their policy until age 26. This one has been eliminated. We talked about it earlier, but insurance companies used to have annual and lifetime maximums. So many people in this country foreclose on a home or go bankrupt because of really costly medical bills. And hopefully by the insurance companies having to pay for those very costly times in people's lives, that will also help our economy in other ways. And the justification for this was that insurance companies are run for profit. So they could run and pay for those annual and lifetime costs. So let me get specific finally. Let me get specific on the Affordable Care Act. It has three main prongs, like three ways to get people insured. The first one has to do with using something already in place. That's Medicaid. Medicaid is health insurance for low-income people. You have to be very low-income to qualify. And your states run Medicaid. So the idea was expand Medicaid to get more low-income people insured. And with that, improve Medicare. So get more people insured that are low-income through Medicaid. Then what about those people who aren't necessarily low income but can't get insurance? So someone who maybe is self-employed or making good money in 2 part-time jobs, or just makes enough money at a company that's too small to provide insurance. So the second prong is to open up a place where people can go buy their policy. Don't make it something exclusive through employment. We have 300 million people in this country. Can't we get a group of people together that all need insurance and can get a policy without having to go through their employer? So the open marketplace would be a place where you could go and pick your policy, gold, silver, bronze, and a host of other ones. And with this open marketplace too, it should be somewhat based on income. So you can get an affordable policy to match your income. Of course, if you are making a lot of money, then you're going to still have to pay a pretty high premium. So these two together were supposed to kind of close the gap. So by bringing Medicaid, expanding Medicaid, you get more poor people insured. And then by providing these open marketplace for people to buy, you'd get people who might be earning enough money but didn't have access. You'd be getting them the access. Now, to incentivize people to actually go and buy their policy, because who wants to spend money when you could not spend money? You put a tax penalty. So if you don't have insurance, you'll pay, it's actually a pretty small tax. And then provide affordable options. Don't give people just one option that they can't afford. So that has, in many parts of the country, worked to get people health insurance. And then the final prong we spent the most time on, and those are actually improving policies, like actually regulating the health insurance industry. Just like the federal government regulates a number of other industries, health insurance too could be regulated. That there should be some rules for how they operate to protect consumers. And when you think about a health insurance policy, remember, you are a consumer. You've paid for this, and there needs to be something in place to keep those companies following rules for their consumers. So preventative care is now covered, which is also pretty smart for the insurance companies to cover because preventative care is generally cheaper than reactive care. No annual lifetime maximums. We've gone over that plenty. You can't be denied coverage for a pre-existing condition, and those under 26 can still get insurance on a parent's policy. So what you'll look at on this last slide is Medicaid expansion. So you might notice a pattern of the states here that expanded Medicaid. Oh, I'm going to move my face in a second. Can I do it right now? All right, hopefully that worked. States that expanded Medicaid to receive federal money. The way the Medicaid expansion works is with the Affordable Care Act, the federal government was going to roll out in the early years extra money to help the states to expand their Medicaid. But the plan is ultimately to get the states running this program without the federal money. So that is the reservation for a lot of states, that they don't want to commit to expanding Medicaid for fear that in the long run it would not be fiscally prudent for them, that they might not be able to afford paying for that Medicaid later when the federal government is no longer funding it. This is also, remember, that vocabulary term we learned, an example of cooperative federalism, that the two governments, federal and state, sort of work together on things, but money is sort of the driver of how they work together. Now this chart down here shows that states that did not expand Medicaid kind of left people out. So you'll see if you can afford one of these health insurance policies, you got insurance. You went on the open marketplace, you could afford it. But there's still a lot of people who can't afford it. But they're also not poor enough to have Medicaid. So states had sort of closed the gap. The blue states here have closed that gap, but the red states have not closed that gap as much. And for y'all, you live in Texas, so you have a lot of folks that are right here in the middle, not poor enough for Medicaid, but still not feeling like they have enough money to buy their own policy. Okay, that's healthcare. Come see me if you have questions. I certainly haven't answered it all, but I think you have a good intro.